Hi guys, Dr. Ryan here.
Dr. Vince here.
Okay, so we're gonna go over a very, very important concept today, and we like to call this the road to recovery, okay? There's certain time frames and there's certain differences between types of care that you may get, and it's very important to understand the differences of those, okay? So the first thing you look at with the road to recovery is time frame, so whether it takes days, weeks, months, or years, there is a time frame in terms of how people heal and get better, okay? Now the first ideology I want to talk about first is symptom care. And this is what we're used to. On the last video, Dr. Vince was talking about the Band-Aid approach versus actually getting to the root cause of the problem. So quite often when you look at people, they come in a certain stage of care, right? Or in a certain phase of life and how they're feeling. Now this is where they're suffering, they're in pain. Quite often, especially men, they wait a little bit too long to start looking for the cause of their problem and start to address it, right?
Which is why men die earlier than
7 years.
Typically do.
7 years.
On average, 7 years.
That's actually funny, but it's a fact.
Yeah.
So they come in a state of pain, right? And people have a few directions they're gonna go. So with chiropractic care and vitalistic type care, it's very different. But when you go to your medical doctor and you have a headache or you have heartburn, quite often they give you that medication. So when you look at that type of care, quite often the great thing is you feel good right away, okay? So you feel good, you take this medication, but the reality is, are you addressing the root cause of the problem when you take a medication? No, okay? So you go along this kind of how you're feeling pathway here, and you get to a certain point. And this is a very distinctive spot I want you guys to remember, because we're gonna go back to this point. So what this means, I don't know why this is slipping so much, is when you get here, you're feeling better, but you haven't addressed the root cause of the problem. So if there's something underlying that is causing your problem and you don't correct it, does that cause get better or worse?
Gets worse.
Gets worse, right? So what happens? It's called a relapse, or my heartburn came back, or my headache is back, or whatever the case may be, right? So if you don't address the root cause of the problem, then boom, you go back to square one, you're back to suffering again. And then if you're stuck in this paradigm, what do? Take medications again, take different medications, maybe take a second medication, whatever the case may be, and then you feel a little better. And then you go down this negative pathway here, okay? And if you look at this over time, again, you're not addressing the root cause of the problem, your body's never healing, and it keeps going in this disease process down where you get worse and worse and worse. Does that make sense? So that's a typical medical paradigm. Now in terms of what we love to offer is corrective care. So we look for the cause of your problem and we start to address it. And quite often patients come in here and you look at their x-rays, Dr. Vince, when you look at their x-rays, are most people surprised to see what they see?
Absolutely.
And what do you mean? What do they see?
I mean, most people have no clue the condition of their actual spine. You know, it's one of those things that in the United States of America, we teach people, our children from young age, we teach them dental hygiene. We teach them to take care of your teeth. What happens if you stop brushing your teeth, Dr. Ryan? What happens? Rots. They fall out. Yeah, your teeth die. But we don't teach people the importance of maintaining the health of your spine and of your nervous system. And so people get these issues and they have no clue to think, well, what the heck does my spine look like on my x-rays?
Right.
It's one of those things that every human on earth should get their spine evaluated by a trained corrective care chiropractor, but it's just something it's not part of our culture. People don't know about it. Unfortunately, most people finally make the appointment here with us where they're at that critical point where they've tried everything. They've tried all the drugs, they maybe even had failed spinal surgeries, or the doctor's telling them the only option is surgery. Finally they say, okay, I had a good friend that came to the Wellness Center and it changed their life. I guess I'll make an appointment to see what all this craziness is all about. Is that correct?
Yeah, absolutely, yeah. And then what happens, you guys chose to start care, right? So here you are in the suffering state where you came in finally, get your problems checked, and then you start care, okay? Now the good news about what we do in here, typically people when they start care, quite often we start to see a good quick shift in the right direction, okay? However, a lot of the time, people take time to heal. They've had these problems, they've had phase 2 degeneration, they have arthritis, they have, stenosis, whatever going on. It can take people time to start feeling better.
And I'll say with that, the worse that your spine was prior to coming in here, the longer that period of feeling crappy is.
Yeah.
Is that accurate?
Absolutely. Yeah. Because like you always say, it takes decades to get to the point where they saw their x-rays.
Yeah.
And when you start reversing it, it just takes time, right?
And we're pretty good at reversing 2, 3, 4 decades of degeneration. We're pretty good at reversing that in roughly a 12-month period. But again, the longer the problem has existed, the longer it takes to get out of that cycle where you don't feel so hot.
Right. And the third scenario is actually people get worse. Okay? And I'm not gonna lie, my personal worst case scenario with patients when I see them is I love when people get better immediately or even get worse immediately, because that means we actually address the cause of their problem.
We're changing things.
Right. The guy who's filming right now is Ben Neese. Say hi, Ben.
Hi.
From OB Beans, and he's also a coach at Orange Theory Fitness. And have you ever seen someone maybe a little out of shape come into the gym, right?
Yes, I do.
Are they sweating their buckets off?
Oh, yes.
And then how do they feel the next day?
They feel terrible.
They feel terrible, right? But is that a bad thing?
No, sir.
Because they're starting a healing process. So yes, you can feel worse, and that's not necessarily a bad thing. And quite often it's quite a normal thing. It's just how the body reacts, right? But either way, with how specific we are with our x-rays, our diagnosis procedures, and your treatment protocols, we are 100% certain we are doing the right thing to start you off on this pathway towards your optimal health and goals, right? Dr. Vince went over this kind of time frame of from here to about here. That's 120 days. And this is up to here, sorry for my markers running out, is up to about 12 months, right? This is the kind of time frame we're looking at. And then you get to here, and so that's why I touch base on this little point again, because when you get to here, all of a sudden you're feeling better, right? Now, if you go through 10, 12 visits of care, and all of a sudden you feel better at this point, and you stop care, what do you think happens? Have you corrected your problem? No, so if you leave here, what do you think happens? Your problem gets worse. Does that make sense? So it's the same kind of paradigm that if you quit care right after just when you start to feel better, again, you're gonna go through this negative cycle, and again, that disease process over time is gonna get you. So that's what we love to do. You guys are getting into phase 2 of care. We anticipate you should be anywhere roughly from about here to here after your first phase, and in phase 2, we're gonna springboard you in this direction.
Phase 2 is my favorite phase of care because we have a phrase for it. We call it getting over the hump when we get out of that first phase of treatment, because that's when finally breakthroughs are starting to happen. That's when curves are finally starting to be restored. We don't even start clinically keeping score until around visit 12, because the first chunk of treatments, we're just knocking the cobwebs off these joints that have been stuck, glued together for the last couple decades. Phase 2 is finally where things start to move better. That's where it's
freedom.
It's beautiful, absolutely.
And I always use the analogy of like a snowball. You got the snowball right here, right? And you're pushing the snowball up, going up the hill, and may that snowball get bigger as you go up the hill. So does it get harder to push? Does it feel good to push the snowball up the hill? No, it may not feel good, right? But then you get the snowball to the top of the hill, and then once you get it over the hill, what happens? Gravity takes over. And that's where you feel that freedom and like function back in your body. You're able to enjoy your body again like you're supposed to, right? And then yeah, we'll go through phase 2 of care, phase 3 of care. We're getting you right to about right here. And then this is where Dr. Vince is an expert explaining kind of like the maintenance phase of care and how that works.
Exactly. So during those first 4 months of treatment, that's where we make 60 to 80% of the actual progress in terms of correction of your spine, dropping pain levels, dropping symptoms. That's a big chunk of work. And again, we commend you guys for investing in your health to get that. But the cool thing is your healing is not done. On average, we see when we look at the 1-year timeline, we see on average those last 8 months of treatment, at least another 20% increase in terms of dropping pain levels, checking goals off the list, and just feeling better, as well as your x-rays looking better. So the maintenance period is so critical. And I have a lot of patients that have finally grasped this topic when we're talking about the maintenance. You know, and I always bring up the point, you know, what happens if we stop the good things that got us here? What happens? You'll go back again. But good news, maintenance is easier. It's a fraction of the work. It's a fraction of the time, energy, and money that you have to invest in your body. But there's still significant returns on that investment when you just commit to the maintenance schedule. The saddest thing is to see someone commit time, energy, and money into correction, and we hit 60-80%, and then they can't do maintenance for whatever reason. It's not a priority at that point, because we see there's so much untapped potential that they're not taking advantage of. And the fact is, we know every time if there's not some level of maintenance that's kept up, that person's going to regress again. And that breaks our heart because we put our heart and soul into getting everyone to that point where they feel good. So maintenance is so critical. I can't highlight that enough. I mean, the honest to God fact is this: the rest of our lives, as long as we put a little extra effort through this maintenance phase, and for the rest of your life after, to keeping those joints open and keeping them moving. If you keep it open, moving, and in alignment, you will never have issues with your spine the rest of your life. I mean, you'll be 100 years old, be able to bend down, touch your toes, swing a golf club. That's absolutely doable. But that idea of being 100 years old and swinging a golf club, most people cannot fathom that, because by the time they get to their age 60, let alone 70, 80, and 90, their spines have been so decayed and compressed that they feel hopeless. They feel like there's no way I can be active at that age.
Exactly, yeah.
And so we love educating people on this because myself, Dr. Ryan, we're going to be here till at least we're 100 years old, thriving. Absolutely. So we want all of our patients to be there with us.
Yep. So keep flossing your teeth, keep brushing your teeth, and keep your spinal hygiene up. It's equal or more important than that. So.
Absolutely. And another thing too, like we have a lot of people, they're entrepreneurs, business owners, financial planners, and I love looking at their research on maintenance care because it is mind-blowing. The fact is, people that average 1 to 2 chiropractic adjustments per month for their lifetime, the course of their entire life, they end up spending on healthcare 1/7 the amount of money than people that don't get chiropractic care. So just from a financial standpoint alone, if your goal is to save money throughout the course of your life, a little maintenance treatment after you're done with your treatment, after you're done with your correction, will save you exponentially the amount of money as you go through the course of your life.
I still see the same study. It's still the same study. The ROI is 7 to 1. So every dollar you spend on your wellness and maintenance right now equates to $7 in savings later in disease care.
And let's talk about the flip side of that is the people that neglect that and they don't actually prioritize that. What's the biggest cause of bankruptcy in the United States right now? Healthcare. It's health, it's medical bills from so many of these issues that are preventable. So again, this is where we like to empower patients. You're not victims. You can take control of your health, but I do think it's important to shift sometimes our priorities and think about, okay, where am I putting my money and what's the best return on that investment for me?
Absolutely. Cool. Well, I think you guys can understand that. That is awesome. Now we only have one last educational video, and you're going to see this video right before you start your second care. And we're going to walk you through quickly right now how all these active exercises, you see all the people at the front wearing funny things on their head or standing on vibration platforms, and we're going to explain how the next phase works and how we're going to implement you into that as soon as possible. So we'll see you then.
Bye.
Thank you.